Will doctors be required to take painkiller medication training because of the prescription drug abuse trend? An expert panel made a recommendation to the USF that doctors who prescribe painkiller medication be required to take training for these drugs in order to combat opioid dependence and addiction. The initial decision by the agency does not require physicians to take this training in order to provide strong pain medications, but it is recommended on a voluntary basis. Prescription drug abuse continues to rise in Canada, the USA, and many other countries. In recent years, the number of these drugs hitting the street and being used for recreational purposes is very high. Many officials hope that Congress will eventually enact a law that requires mandatory training for physicians on these prescription medications in order to stop the growing trend of abuse. Many people engage in prescription drug abuse, with strong painkillers usually being preferred on the street. Mandatory training for physicians in this area is not a bad idea. Many doctors overprescribe narcotics for patients who constantly complain of chronic pain. Sometimes these drugs are not actually needed and other methods may be just as effective, without the risk of the painkillers being sold on the street or used for recreational purposes. There are treatment programs available for opioid dependence and addiction that work, but it is important to do your homework before you decide which program to use. Medical detox can help you get through the initial withdrawal stages, and extensive therapy that includes group sessions and one-on-one counseling can help you get back to where you used to be. Your future does not have to include prescription drug abuse. All you have to do is take the first step and ask for help.